Look, I'm going to tell you something today that might actually save your life, and it's something that has likely been hiding in plain sight on every single blood pressure reading you've ever had. You know those two numbers, right? One sitting right on top of the other. You've seen them hundreds of times at the doctor's office, on those machines at the pharmacy, or maybe on your own monitor at home. Your doctor mentions them at every single visit. But here's the thing that almost nobody explains clearly to people over 60. One of these numbers is significantly more dangerous than the other as we age. And the scary part, the number that is currently responsible for more heart attacks and strokes in seniors might not be the one you're actually watching. I've spent over 20 years as a cardiac surgeon, and I can tell you from first-hand experience that I've operated on thousands of hearts that were absolutely destroyed by high blood pressure. I have literally held failing hearts in my hands. I've seen the devastating aftermath of stroke after stroke, where a person's life is changed in an instant. And what breaks my heart the most is watching families torn apart because someone they loved was focused on the wrong target, ignored the wrong number, and ultimately paid the highest price possible. What I'm sharing with you isn't just a theory I read in a textbook. This is based on decades of research involving millions of patients, and it is proven life or death information that every single person over the age of 60 needs to understand right now. By the time we're done today, you're going to know exactly which number poses the greatest threat to your heart, your brain, and your future. You'll understand why this specific number becomes a predator as you get older, and most importantly, you'll know exactly what to do about it starting this afternoon. This might be the most important talk we ever have, so please, stay with me, because the answer is probably going to shock you.
Let's just start with the basics for a second because I need you to really visualize what's happening inside your body when those numbers are taken. When that cuff wraps around your arm and squeezes tight, it's measuring the pressure of your blood pushing against your artery walls. But your blood pressure isn't like the air pressure in a tire. It isn't constant. It pulses. Every time your heart beats, the pressure spikes and then it drops. That's why we have two numbers. The top number, which we call the systolic pressure, is the maximum force your heart exerts when it contracts and pushes blood out into your system. Think of it like a powerful wave crashing against a shore. That's the peak moment of pressure. The bottom number, the diastolic pressure, is the minimum pressure in your arteries when your heart is resting between those beats. It's the calm between the waves. So, if your reading is 150/90, it means your peak pressure is 150 and your resting pressure is 90.
For decades, the medical community focused intensely on both numbers. We thought if either one was high, the risk was essentially the same. But over the last 30 years, as we've tracked millions of people, watching who has the heart attacks, who suffers the strokes, and who sadly passes away, a very clear, very specific pattern has emerged. And this pattern becomes incredibly loud the older we get. I want to tell you about two patients of mine, Margaret and Robert, because their stories illustrate this better than any graph ever could. Margaret was 73, vibrant, and incredibly independent. She came in for a routine checkup and her reading was 165/70. Now Margaret was actually smiling. She told me, "Dr. Tammy Aiken, my bottom number is perfect. I've worked so hard to keep it under 80 and look, it's 70. I know the top one is a bit high, but my previous doctor said as long as that bottom number stays low, I'm doing great." I wish I could tell you that doctor was right. But 6 months later, Margaret suffered a massive stroke. The left side of her body was paralyzed. Her speech was gone, and that independent woman was suddenly dependent on others for every single basic need. Why? Because years of that high top number had been silently hammering the arteries in her brain, even though everyone was celebrating her perfect bottom number. Then there was Robert, who was 68. His reading was 128/95. Robert was a nervous wreck. He'd read online that the bottom number, The diastolic was the real killer because it meant the heart never got a chance to rest. He was terrified of a heart attack. We did a full workup, stress tests, calcium scores, the works. His heart was actually in great shape. Yes, we needed to help him bring that bottom number down, but his actual risk of a catastrophic event was nowhere near what he feared. These two stories represent the confusion so many people face. But the science is finally giving us a definitive answer to the question: which number is more dangerous? Here is the reality. The answer depends on how old you are. If you're 30, the bottom number tells us a lot. But for my audience, those of you over 60, the research is crystal clear. Massive studies like the Framingham Heart Study and the MRFIT study, which tracked hundreds of thousands of people for decades, all pointed to one conclusion. After age 60, systolic blood pressure, that top number, is a far stronger predictor of heart attacks and strokes than the bottom number. In fact, in older adults, that top number is 2 to 3 times more likely to predict a major health crisis. But it gets even more interesting and, frankly, more dangerous. As we get older, many people notice their top number going up while their bottom number actually stays the same or even drops. We call this isolated systolic hypertension. For a long time, even doctors thought this was just normal aging. We were wrong. It is not benign. It is not just a part of getting older. It is a dangerous condition that skyrockets your risk for heart failure and kidney disease. The good news is that the research also shows that when we specifically target and treat that high top number, we can reduce stroke risk by up to 40%. That is a massive life-saving margin. So let me be as clear as I can. If you are over 60, that top number is the most dangerous number on that screen. It is the one you need to watch like a hawk. Now, you might be wondering, why does this happen? Why does the top number become the villain as we age? It comes down to the health of your pipes. Your arteries aren't supposed to be rigid like PVC pipes. They're supposed to be elastic, like rubber bands. When you're young, your arteries are flexible. They expand to absorb the wave of blood from your heart, and then they snap back. This keeps the top number low and the bottom number healthy. But as we age, those elastic fibers start to break down. They get replaced by stiff collagen. Calcium starts to deposit in the walls. Your arteries become less like rubber bands and more like stiff old garden hoses. When your heart pumps blood into those stiff tubes, they can't expand to absorb the pressure, so the systolic pressure shoots through the roof. But because they are so stiff, they don't recoil well during the resting phase either, which is why the bottom number often stays low. This high top number isn't just a measurement. It is actively damaging your body with every single beat. Imagine waves hitting a sea wall. A few big waves are fine, but millions of them, day after day, will eventually crack the concrete. That is what high systolic pressure does to your brain, your kidneys, and your eyes. It creates tiny, microscopic injuries. In the brain, this is particularly scary. The delicate vessels there can't handle that constant pounding. They can develop tiny weak spots that rupture, or they can get narrowed and blocked. Even if you don't have a major stroke, this chronic hammering causes thousands of tiny, silent microstrokes. Over time, this leads to vascular dementia, memory loss, confusion, and personality changes. Many people who think they are developing Alzheimer's are actually suffering from years of uncontrolled top-number blood pressure. Your heart suffers too. Imagine having to push a heavy door open thousands of times a day, and every day that door gets heavier and harder to move. That's your heart trying to pump blood into stiff, high-pressure arteries. To cope, the heart muscle gets thicker and thicker, but a thick heart is a stiff, inefficient heart. Eventually, it just can't keep up. That's how you get heart failure. Not from one big event, but from years of your heart working overtime against that high systolic pressure. Now, I have to address a big point of confusion. Does a low bottom number mean you're safe? Not necessarily. If you have a very high top number and a very low bottom number, say 170/55, That gap is called wide pulse pressure. It's actually a sign of very severe arterial stiffness. And here's the tricky part. Your heart's own blood supply actually fills up during that resting phase, the bottom number. If the bottom number drops too low, like below 60, your heart muscle itself might not be getting enough blood. This is why we need a balanced approach. But if we have to choose which one to prioritize getting under control first, the evidence says it's that top number. So, what should your goal be? The guidelines changed recently, and they're much stricter now because the data showed we were being too relaxed. Generally, for most people over 65, we want to see that top number below 130. For some very healthy seniors, we even aim for below 120. Now, if someone is very frail or over 80 with a lot of other health issues, we might allow it to be a bit higher to avoid dizziness or falls. But the old rule that it's okay for your top number to be your age plus 100, that is outdated and dangerous. If your top number is consistently over 130, you need to have a real, honest conversation with your doctor. And if your doctor dismisses a 150 systolic reading because your bottom number is 75, you might need a second opinion. I know what you're thinking. Does this mean more pills? Not necessarily, but we have to look at the whole picture. Lifestyle is the foundation. First, we have to talk about salt. Most Americans eat way too much sodium, which makes your body hold on to water and jacks up that top number. Cutting back on processed foods and not reaching for the salt shaker can drop your systolic pressure by 5 to 10 points. That's like the effect of a whole medication. Second, weight loss. Even losing just 10 pounds can drop your pressure significantly. Third, movement. I'm not saying you need to run a marathon. Just 30 minutes of brisk walking most days helps keep your arteries more flexible. It's literally like oiling the hinges of your cardiovascular system. But I want to be very real with you. For many people over 60, lifestyle isn't enough on its own because we can't completely unstiffen arteries that have been aging for decades. Medication is often necessary, and I want you to hear this clearly. Taking blood pressure medication is not a failure. It's not because you didn't try hard enough. It is a tool to protect your brain and your heart. There are so many different types of medications now, diuretics, ACE inhibitors, calcium channel blockers, that we can almost always find a combination that works without making you feel like a zombie. If a pill makes you feel bad, don't just stop it. Tell your doctor so you can try a different class. One of the biggest mistakes I see is people only checking their pressure at the doctor's office. Some people get white coat hypertension, where their pressure spikes just because they're nervous at the clinic. Others have the opposite, where it looks fine at the doctor but is high at home. You need to be the CEO of your own health. Get a good home monitor, check it a few times a week, and keep a log. That data is gold for your doctor. It turns you from a passive patient into an active partner. I often think back to Margaret. I genuinely believe that if she had known what you know now, that her 165 systolic was a ticking time bomb despite her good bottom number, she would still be the independent woman she once was. She just didn't have the right information. You have it now. You know that top number is the one that predicts your future. You know why it happens, and you know it can be managed. So here are your marching orders. Check your pressure this week. If that top number is over 130, make an appointment. Start cutting the salt today. Keep moving. And please, don't wait for symptoms. High blood pressure is called the silent killer for a reason. The first symptom is often a stroke. We want to stop it long before that happens. If this information helped you understand your body better, please hit that subscribe button. I'm here every week breaking down the real science so you can live a longer, healthier life without all the medical jargon. And do me a huge favor. Share this video with someone you love who is over 60. There are so many people out there like Margaret who think they're safe when they aren't. Let's help them. Leave a comment below and tell me, did you know about the danger of the top number? What are your numbers usually? I try to read as many comments as I can to help guide our next conversation. Your heart has been beating for you for over 60 years. Now it's time for you to do something for it. Take care of that top number, and I'll see you in the next video.